Alright, hello everybody. My name is Mario Barrera, and I'm going to be going over Lab 1 for Bio 201 and 210, the Introduction to Anatomy and Physiology. Now, this is primarily just going to be a video focusing on the content. Whatever specifications I have in class, we will go over when we meet in person. The time is currently 3:20 a.m. because I forgot to record this earlier, so that's fun. Now let's go ahead and get into it. First thing I want to do is go ahead and swap to presenter view, get my laser pointer going, and now we are cooking. So, Lab 1, anatomical terminology, orientation, and movement, because we have to know what we're talking about before we start talking anatomy. So, getting into it, anatomy and physiology. What exactly does this mean? So, anatomy is essentially referring to cutting up. It is essentially the science of the structure of the body and the relationships among those structures, more so how those structures are physically connected to one another. Physiology, on the other hand, is the study of nature. So this is more so studying and focusing on the functions of the body. So while these two are hand in hand with each other, there is a slight distinct difference versus studying anatomy versus studying physiology. And general, as a general rule of thumb at Grand Canyon University, there's a lecture and lab portion for anatomy and physiology. Generally speaking, the lecture portion tends to go into a bit more of the physiological concepts, how the body is actually functioning and working together, versus the lab is more so about identifying those structures. Both skills are very equally important. But in this lab, we're primarily going to be focusing on a lot of memorization and a lot of identification. So, first thing to talk about is anatomical position. Now, anatomical position is the standard reference for the human form. As you can see here, this nice young lady is sitting in anatomical position. The body is upright, which means it's standing erect. Head is facing anteriorly. We'll get into what this anteriorly is referring to in just a bit, but as a general rule of thumb, it just means facing forward. Upper extremities, so extremities referring to the entire length of her arm, because we're going to learn that arm and forearm are two different portions of the body, and we're going to be very distinct when we're talking about different anatomical terms in class, because medicine is a very exact kind of science when it comes to anatomy. So, feet are positioned flat on the floor to the mid-clavicular line. That's referring to her collarbone, so it's about the mid-level of her collarbone. The reason why we have this anatomical position is because we want to refer to a commonality between two physicians, maybe a nurse and a physician. Pretty much when you're dealing with this, when you're talking to somebody else, you want to be thinking anatomical position. It just makes things easier. It lets everybody know this is right, this is left, this is more proximal, this is more distal. It's just a very easy way to kind of go over, a lot of differences of the body. Because the body can be in multiple positions, but if we're all talking about the same anatomical position, it makes it easier to find like a common denominator. One other thing I want to point out too is that right and left for you and I is flipped here. However, the right and left is working for the patient, an anatomical position, and whenever we are talking about rights and lefts in class, we are always referring to the patient's right and the patient's left. So let's take a look at some terminology. Our next patient, Sandra, 27-year-old female, complained of pain in my head, chest, and stomach following a motor vehicle accident. And her legs don't hurt. Oof, that is not good. She has severe bilateral subepidural bleeding involving her lower extremities and around her mouth. There's an open wound on her left lateral thigh, 8.9 centimeters, proximal to the left lateral epicondyle of the femur, where the arrow is approximately. She is orientated to time and space. Her vitals are blood pressure is looking pretty average. Respiration, it's a little high. It's understandable though. She just got in a car accident. Now, a lot of these terms that are highlighted probably don't mean a whole lot to you. This is all kind of looking like gibberish. But by the time we are done with this first lesson at least, you should be able to take a look at, generally speaking, any kind of notes made by a doctor and understand, at least get a general idea of where we're at in the body. She needs imaging and blood work. So, first thing we're going to talk about is SOAP. Now, SOAP is the general, essential procedural outline that we use when we're looking at patients. So, it is an acronym, so that means that each of these letters is going to stand for something. The first S is referring to the subjective portion of the observation. So, what the patient describes or complains about. They have pain in my head, chest, and stomach, my legs don't hurt. This is all things that the patient has described to us. So, subjective, like a subjective experience, something that is personal, is referring to what the patient describes to us. Objective is referring to what is measurable. If you are somebody who is very objective, you're somebody who just likes to look at the facts, just like this portion of the observation. Objective is looking at the vitals like temperature, blood pressure, physical examines and findings and tests, x-rays, blood tests, all that kinds of stuff. The next A is referring to assessment. So the assessment is the diagnosis and differential diagnosis. So just a short little snippet. Differential diagnosis just refers to you've basically broken down this disease or cause of an accident to several different possibilities, and they all have the same potential. That's kind of what you get for a differential diagnosis versus a diagnosis just like this is very exact. And then finally, the P is the plan. This TX right here denotes treatment. What are we going to do to fix the problem? So, moving on a little bit into various imaging structures that we got going on. We have a different cuts and different views to look at the patient. Now, this is something that is a very handy tool because you want to be able to look at a patient from all kinds of different angles. Now, we have three different planes that we're going to talk about here, and one little subplane that's not really brought up in this image, but I'm going to go ahead and describe it anyways. We have the frontal plane. So the frontal plane is referring to this purple piece right here, kind of cutting across, dividing her body into an anterior, into a posterior half, or into a front and a back side. So this is going to give us this kind of image looking into the patient, looking directly towards the patient, from behind or from the front. We also have a, let's go with transverse plane first. So transverse plane is referring to across. So this is something that is going along, if you're more of like a mathematical minded person, this would be like your x-axis. So this cuts our patient up in half from top and bottom portions, so we can take a look upwards or a look downwards into her internal cavities. And then finally we have the sagittal plane. So the sagittal plane is going to divide our patient into a left portion and a right portion. Now the reason I brought up a little like subplane is because there's a difference between a sagittal plane and a mid-sagittal plane that I do want you guys to know the difference between. So a mid-sagittal plane refers to any plane that is directly right down the nose. So this is exact, cutting your patient into a left and right portions of the body, versus a sagittal plane can refer to, taking a snippet down here on her shoulder, or further off. Basically anything that is not centered is referred to as a sagittal plane, versus a mid-sagittal plane is very exact, right down your nose all the way down your belly button and continuing. Terms of direction. So now we're going to get into differences of terms and directions. So let's start on this left side over here. Now taking a look up front, we have anterior or ventral, as well as posterior or dorsal. So anterior refers to coming before. So ante refers to before. There is not a whole lot of modern English terms that are used in daily conversation using the word ante, but if you play poker, that's always a fun one. When you ante up, that means you put in a bet before you get to see the cards. An ante chamber is like an ancient room people used to use for basically the front living room, if you will, for back in the day. Another term that's can often be used is ventral as well, except you're going to see that ventral and dorsal do not nearly come up as often as anterior and posterior. Ventral and dorsal we'll see a lot more when we start talking about the nervous system way down the line. But for now, As long as you know the difference between these two, this is very important, of the utmost importance. So taking a look at posterior, post refers to after. So you probably heard of like the post credits scenes in Marvel movies. You know, this is referring to after the credits. So posterior is just referring to the backside, the part that comes after. Dorsal is also referring to the backside of a patient. Dorsal, you can think of a dorsal fin on a dolphin. The dorsal fin is found on the posterior side of the dolphin. So you could just imagine what a dorsal fin would look like on you. That's how I remember dorsal, at least. Let's see. Ventral and dorsal, that's also used a lot in veterinary medicine, as well as cranial and caudal that we'll see. So cranial is referring to like cranium, basically your head, where your brain is kept. And then caudal actually directly translates from the Latin as tail. So this is referring to the lower end, basically down your vertebral column. That's something else that's going to be pretty exciting during this class is one of the best ways for that I learned anatomy was that I translated a lot of the terminology that we'll kind of come into contact with, and I plan to do the same thing with you guys as I kind of lecture on various components of anatomy. I'm also going to be bringing up, you know, their origins or like why the word is the word that we use. In my mind, at least, it makes things a lot easier. Hopefully, you guys will see that as well. So let's take a look at our lovely patient in the anatomical position. We got a few different kind of references here. First up, actually, we should take a look at superior and inferior. So superior is referring to above, like a superhero flying above, and inferior is referring to beneath. So you can kind of think of this as like, you know, let's say you're working at a corporate job and your superiors, you know, the administration, your bosses, those are the people above you. And, you know, I guess if there's new recruits, those would be your inferiors, the people you're training, although I would not call them inferior. That's pretty rude. Taking a look at the extremities. So extremities is always referring to the arms and the legs, essentially. Um, Taking a look at extremities, we have terms also designated for them very specifically. We have proximal and we have distal. So proximal, you want to think of proximity, something that is very close to you or very close to, in this case, our torso, our origin of mass, essentially the center of our mass. Distal is referring to distance, so going farther away. So let's say if I were to describe the position of my elbow in the context of my hand, I would say that my elbow is more proximal than my hand. Also, we can flip the script. If I take my hand in the context of the elbow, I could say my hand is more distal than my elbow. So you can kind of see how those start to work together. Same thing kind of works here for superior and inferior. You know, my head is superior to my belly button. And so on and so forth. This also works for the legs. So the more proximal portion of your thigh is going to be attached to your abdomen up here, and then your distal portion is going to be your foot all the way down here. So in this context, you can actually say your foot is inferior in both contexts and be correct. But if you want it to be more specific in relation to just the leg, you know, if we're just looking at this upper extremity or lower extremity here, we can refer to it as distal and proximal. Something else that I'll also point out is the term arm and leg often get thrown around a lot, but you know, when we're actually learning, you know, real anatomy, we want to make sure that we're using these terms correctly. So I'm just going to point this out real quick. From about our shoulder down to our elbow, that is the arm. So that is what we commonly know as the arm, or more so, what we commonly refer to as the arm is like referring to the shoulder all the way down to the tips of your fingers. This is not correct in the anatomy world. So your arm is referring to the elbow point up to your shoulder. Your forearm would be your elbow point down to your wrists, and then your hand would be at your wrist down to the tips of your fingers. Let's take a look at our lower extremity. Extremity is referring to the entire appendage. So if I said upper extremity, I'd be referring to the entire appendage here, but if I just said arm, I'm referring to this region above the elbow. Now for the lower extremity, the region from your hip down to your knee, this is referred to as the thigh. From the region connecting your knee down to your ankle. This is going to be referred to as your leg. Now, I know you guys like to say, from your ankle all the way up to your hip, this is your whole leg. Not anymore. We are changing the script. So, leg is from your kneecap down to your ankle. Then from your ankle to the tip of your toes, that's going to be our foot. But you guys already knew that. Quiz yourself. You guys can quiz yourself. I have quizzed myself enough on this. So, body cavities. Now, a cavity, if we're going to translate this directly, cavity refers to an open space. This is actually the same context used when you go to the dentist and you have a cavity. A cavity refers to an open space inside of your tooth in this scenario. But in general, in anatomy, on the inside of your body, these body cavities are really good because they allow us to put organs in an otherwise very small space. So let's go over some of the different body cavities. If we're breaking these down into by the region of dorsal and ventral, or posterior and anterior, the dorsal cavities have a cranial cavity and a spinal cavity. So the cranial cavity, that is where we keep the brain, the master of it all. The spinal cavity is essentially the portions connecting the brain in the spinal cord running down the length of your back. This entire spinal cavity encompasses around your spinal cord. Moving on to our ventral cavities, we have our thoracic cavity. Now, you guys may have heard of the term thorax before. Your thorax is referring to your chest. So from about your neck down to, let's see, basically it's cut off at our diaphragm. So do you see this portion right here? This is our diaphragm. I was trying to think of a landmark that you guys might know. I guess it would be a few centimeters superior to the belly button, but it's a little complicated, so we'll just stick with this. Thoracic cavity is referring to everything above your diaphragm. And if you guys don't know what your diaphragm is, I am offended. Your diaphragm is this huge muscle meant for respiration that allows you to breathe. Very, very important. So, in our side of our thoracic cavity, we have multiple subcavities, and we'll kind of get to those guys on the next slide. In the meantime, let's take a look at the abdominal pelvic cavity. So your abdomen, is commonly referred to as your stomach. In common language, people say, "Oh, my stomach hurts." It's like, no, your entire abdomen probably hurts. But I digress. So your abdominal cavity is where we're going to keep all of our digestive organs, some kidneys, a lot of other kind of fun stuff. Pelvic cavity is where we're going to keep the reproductive organs. Everything made for making babies is going to be down here in the pelvic cavity. The abdominal pelvic cavity is just referring to the entire region connecting underneath the diaphragm, all the way down to the tips of the pelvic cavity, because technically there's not really a distinct separation here. There's diaphragm. Alright, we'll kind of keep Alright, let's go back real quick, just to introduce this. So, pericardial cavity, let's go ahead and break that word up real quick. So, peri, P-E-R-I, this refers to around. So, peri means around. Cardial refers to the heart. So, pericardial cavity, if we put it all together, pericardial cavity refers to the cavity that is found around the heart. Pleural cavity is actually going to refer to the cavity that is found around the lungs. Unfortunately, there's not a whole lot of breaking down we can do for pleural, but pericardial, it's pretty straightforward, referring to the cavity around the heart. Pericardial cavity is referring to the cavity around the heart. Pleural cavity is referring to the cavity around the lungs. However, there is a bit of an interesting distinction for the pericardial and pleural cavities. And let's kind of take a look at it. So, these linings of the body cavities, first we're going to focus on pericardium because it's much easier to go over. The pericardial cavity is basically encompassed by two different walls, and this is kind of what creates the cavity, is these walls that create a space. So the pericardium is, if we break down that word, peri means around, cardium is referring to this fibrous sheath that kind of lines the heart. So the pericardium is a sheet that kind of lines around the heart, and there are two different layers of it that actually create our pericardial cavity. So there's going to be the parietal and the visceral layer. Now the parietal layer is referring to the portion of the pericardium that is in contact with the world. Not necessarily exposure to the outside world. I just mean basically everything else inside of the thoracic cavity. Versus the visceral pericardium is what is actually in contact with the organ. So whenever I think of visceral, I think of like viscera, like organs and all that kind of fun stuff. Now, a good kind of analogy to kind of compare how this cavity is being created is if you take a balloon. Now, let's say you're studying really hard for your anatomy test that mean Professor Barrera gave you, and you're just really angry and you decide to punch this balloon, right? Well, too bad for you, it's another learning opportunity. So, this space, that's where the air is trapped inside of the balloon. This is known as the pericardial cavity. The lining of the balloon that is in contact with your fist, this is the visceral pericardium. And then the parietal pericardium is this outside portion that's in contact with everything else. And pretty much these bullet points are just saying exactly what I just talked about. Now, the reason that we create these cavities is to kind of create a smooth transition from basically not, it's to make sure your organs are not bouncing around all over the place, and also to make sure that when your organs are rubbing up against each other, it's not hurting. It's not causing a lot of friction. Basically, these cavities allow for a type of serous fluid to kind of flow through and to kind of reduce friction, make sure there's no kind of burn, there's no wear and tear damage, if you will. Oh, would you look at that? Serous membranes. It's almost like we just talked about that. So, a two-layered membrane that secretes a watery lubricating fluid. Oh, we just talked about that too. They line the thoracic and abdominal cavities and surround organs to reduce friction. That's the primary goal that we're talking about. Now, we talked about the visceral and the parietal pericardium, but there also exists a parietal and visceral pleura. So let's go back a few slides real quick. Pleural cavities. The pleural cavities I already told you are around the left and right lung. Here you can see the parietal and visceral pleural as well, which create the pleural cavities. So yeah, it's pretty much the same exact concept as the heart, where we have visceral is in contact with the actual organ, and then parietal is in contact with the rest of the world. Now looking over here, luckily for you guys, each abdominal organ does not have its own cavity, so instead what we're looking at is the parietal and visceral peritoneum. The peritoneum is just referring to the serous membrane foldings that's covering the entire abdominal digestive tract. So we have parietal and visceral pericardium, parietal and visceral pleura, and then parietal and visceral peritoneum as well. Taking a look at this is very likely to be on your quiz or your exam. This is a transverse, right? We just talked about those different kinds of imagings earlier. So a transverse slide that's kind of cutting across this thoracic cavity. So we are looking down into the patient. Here's the anterior side, so this is our chest, and then the posterior side is back here where our spinal cord is found. So in here you can see the right lung and the left lung. Oh, I'm sorry. We're actually looking up at the patient, so from the feet. That kind of orientates us a little bit better. My mistake there. So this is the patient's left lung. This is the patient's right lung. And here, these white spaces are actually going to be the pleural cavities. On the edge, you can see the parietal pleura, and then more so inside, you can see the visceral pleura. That's actually in contact with the lung. Here, this big blob right here is our heart. The pericardial cavity is the white lining around the heart. Just like we have a split up of parietal and visceral once again. This yellow space right here is referred to as the mediastinum. So we're not going to get into a whole lot of detail about what the mediastinum is, but it pretty much houses everything else in our thorax and allows for passage down into our abdomen. So this is where our esophagus is, this is where our trachea is found. There's a lot of different things that go on in the mediastinum, but all I need you to do right now is just to identify that this space right here, this mediastinum, is the space that exists between the lungs and behind the heart, essentially. Technically, the mediastinum goes like, in front of the heart a little bit too, and then also, back here, but I digress. And then spinal cord is, well, you can imagine the spinal cord is pretty easy to identify. I just realized too, one thing I want to go back and touch on real quick for subjective and objective. One more terminology that I wanted to give you guys was the difference, let's see if I can draw here, between a sign and a symptom. Here we go. I am using a mouse, not any kind of other technology, so this is a little challenging. There we go. So the difference between a sign and a symptom. So I'm going to go ahead and underline this second letter here, and I capitalize it for a reason. A sign is something that I, the doctor, has found. So this would fall under the objective category. A symptom is something that you, the patient, has told me. So this is stuff that would fall under the subjective category. Just wanted to clear that out of the way because that was on the back of my mind while I was explaining everything else. So let's move on. Alright, abdominal pelvic quadrants and regions. So, healthcare professionals need a method to quickly locate specific signs and symptoms that their patients may present with and to communicate their findings to each other. Each quadrant or region is associated with specific organs that you can see here. Now, let's start off easy. Quadrants. So, the term quad refers to 4. So there are only 4 quadrants of the abdomen. Taking a look at the belly button, we're going to go ahead and create a little cross here. This cross divides our abdominal section into 4 different quadrants. A right upper quadrant, left lower, and then right lower as well. Remember, this is all in respect to the patient. So even though this is our left, this is the patient's right, so we will always refer to it as the right upper quadrant. The abdominal pelvic quadrants have a lot of different regions of organs located on this list for you to know. Moving on to the abdominal pelvic regions. The abdominal pelvic regions are 9 different regions found in the abdominal region. I guess that's kind of redundant the way I said it. Anyways, let's get into it. So let's start straight down the middle. First up, we have the epigastric region. So epi, if we break up that word, means above. Gastric refers to stomach. So the epigastric region refers to the region that is above the stomach. The umbilical region is referring to where your belly button is found, or also known as the umbilicus. And then finally, the hypogastric region. Hypo refers to below, and gastric refers to stomach, like we said above. So hypogastric refers to the region below the stomach. And honestly, this is very low below the stomach. That's why it's also called the pubic region. Now, looking on the left and right, it's not as bad as at first glance. So you can see that these 6 regions on the left and right sides are the exact same name. They're just referred to as the right and left portions of it. So let's focus on one side at a time, and then we'll just reflect it over. So right hypochondriac region. If we break up that word, hypo refers to below. Now, what does chondriac refer to? Chondriac is actually, in this case, going to be referring to our rib cage. So this is going to be the region found underneath our rib cage. The lumbar region is going to be immediately below the hypochondriac region. So lumbar is referring to a section of your vertebrae. This is also known as your lower back region. So if you've ever seen a infomercial that has talked about lumbar support, usually they're referring to just lower back support. So if you wrap your hand around the abdominal pelvic region where the lumbar region is, you'll be in the lower back region. And then finally, we have the right and left inguinal region. So for inguinal region, easiest way to think about this is actually where an inguinal hernia occurs. You guys don't know what hernia or if you don't know what a hernia is essentially where parts of your organ just kind of slip into a space that it should not be in. So this is the region where hernias occur, if that's an easy way to remember inguinal. Here it just shows a very colorful artistic drawing of the different organs found in the different regions. Now, for general anatomical terms, taking a look at this, we have a lot of memorizing to do. So, the ultimate guide for what you need to memorize is going to be found on the Word document. And this PowerPoint is going to help you kind of identify those different regions as well. These next few slides also kind of break down the various regions you need to know. Now, unfortunately, there's not a whole lot of teaching per se that I can do for you here. So this is going to, at least for my students, rely heavily on you guys to kind of self-study, and then make sure you guys are aware of what these different regions are referring to, because all of this is going to come in handy much later on. Something Michael Barton also recommended back when I was his student. He actually introduced us to a game called Find the Mole. So what you necessarily do is you find a partner, and you tell them, "Hey, it's time to find the mole." Maybe do something cooler than that. I'm not very socially smart. Anyways, so let's say you identify a mole on your cheek, right? Your partner is supposed to find it using different verifying terms here. So let's say I'm your partner now, and I said, "Is your mole superior to the umbilical region?" And I would say yes, it's on my well, I wouldn't say it's on my cheek, but I'm thinking it's on my cheek, so yes, that would be correct. So then your partner comes in, "Okay, is it superior to the mammary region?" And I would be like, "Oh, yes, it is." And then I would be like, "Okay, is it superior to the ocular region?" And then in that case I would say like no. So you can kind of turn it into like a 21 question kind of game. Alright, so let's get into movements. This is going to be the final portion of the video. So, a lot of different movements going on. Let's get into it. Now, very first thing we're going to go over is flexion and extension. Now, what I'm going to do is I'm going to give you some very basic definitions and allow you guys to kind of apply it in a variety of different contexts. So, basically your body is made up of a lot of joints, right? And those joints can increase as well as decrease their angle. Now, if a joint is decreasing its angle, like let's say you are flexing your arm, right? You are bringing your forearm closer to your arm, and that's actually lowering the angle. That is known as flexion. If you're going to do the opposite motion, your forearm is moving away from your arm, it's getting pulled back down here. That's going to be known as extension, because you are increasing this angle here. And let me go ahead and draw on it just so you guys get a better idea. So this region right here, you can see how it's getting smaller and then it's getting bigger. This angle is getting bigger and then smaller. So if it is getting smaller, flexion. If it's getting bigger, extension. If it extends past like a 180 degree angle, that's going to be known as hyperextension. And there's not a whole lot of areas you can do this in your body, but your head is one, your wrist would be another one. Flexion, you're making a smaller angle. Extension would be a much larger angle, and then hyperextension past that 180 point. Same thing with your legs if you're doing flexion, extension, hyperextension. Or I guess your hips, my mistake. Taking a look at this, we have abduction and adduction. Now, in case you didn't notice, those words are very, very similar. So, from now on in this class, I'm going to go ahead and refer to them as abduction and adduction, just to make things a little bit easier for you guys to understand, because I don't want you guys to make a mistake because of like a verbiage error. That wouldn't be fair to you guys. So what I like to do is I like to think of the word abduction like a kidnapping. You're being stolen. The arm is being abducted. It's getting kidnapped. It's getting taken away from the body. Versus adduction. Adduction, when you're adding something together, it is becoming bigger, right? So if you're adducting your leg, it is getting added to your center mass. It's getting closer to the rest of your body. You can also perform adduction and abduction, kidnapping with your hands. Circumduction. So if we just think of circum, we can think of circumference, as in going around in a circle. Next up, head rotation is pretty straightforward. We have left rotation and we have right rotation. Two other terms that kind of come up around this region is ipsilateral and contralateral. So it's going to be spelled something along this line. Ipsilateral. Not exactly sure if that's spelled right. It should be lateral. And then we have contralateral. So ipsi refers to the same side. So if something is turning ipsilaterally, that is referring to the same side. Contra is referring to like contrast, like something that's different. So contralateral would be onto the opposite side. These words probably aren't going to come up too often, I don't think, but I just wanted to introduce you guys in case they do. Next up, we have external and internal rotation. And I forgot to bring up lateral and medial earlier when we were talking about it. So I'm going to go ahead and do that now. Lateral refers to the outside portion of your body. Medial is going to refer to closer to down the midline of your body. So medial rotation means moving your arm more towards the inside of the body. Lateral rotation refers to flipping the arm outside the body. So lateral is referring to the outside, medial is referring to the midline coming down the middle of your body. Also taking a look, this is specific for just your forearm. We have supination and we have pronation. So supination refers to having your palms facing up. Pronation refers to your palms facing down. Now, another easy mnemonic of remembering the difference between supination and pronation is that for supination, you need to hold a bowl of soup. So let's imagine we have a bowl of soup here. So supination refers to holding a bowl of soup versus pronation, you'd be throwing the bowl of soup down. Oh no, we have spilled our soup. We don't want that. All right, moving on. Eversion and inversion, this is just referring to your ankle. So in, you want to think of in towards your midline. Eversion, you want to think of exit. It is leaving the midline. It is going away from your body. Dorsiflexion and plantar flexion. So dorsiflexion, dorsi refers to dorsal or like necessarily the top portion of your foot. Dorsiflexion means the top portion of your foot is losing that angle. It's getting smaller. This angle right here. Plantar refers to the bottom of your foot. This is in one of your this is on your Word document, so you should definitely know the plantar region. Plantar flexion refers to basically making this angle much smaller. So plantar is where you plant your feet. Opposition. So basically this is moving your thumb across to the opposite side of your pinky. Easy way to remember this is that we have opposable thumbs. That's where opposition gets its name from. Retraction and protraction. If something is retro, it is something that is old, in the past, or behind. In this case, this is referring to our jaw, how our jaw is moving. So retraction of the jaw will be moving the jaw backwards. Protraction, this refers to progress. This means we're going forward. So this protraction refers to moving the jaw forward. Depression and elevation. If you are depressed, you feel down all the time. You do not feel good. In this context, depression of the jaw refers to bringing the mouth lower, bringing the jaw lower. Elevation, you want to think of something with high elevation like Mount Everest. This goes up. Lateral flexion is just going to the sides away from the midline. And that's it. Get rid of my ink annotations. Alright, I hope you guys enjoyed this first video, and I look forward to seeing you guys in class.